Okay, so let me just check one thing. Hold on. Sivan, is Emma, are you with us?
Yeah, I'm here. Can you hear me?
We can, yes. I will introduce you. One of our guest speakers this evening is Emma Claire Foley, Chair of New York City DSA Healthcare Working Group. New York City DSA Healthcare Working Group is currently working to pass the New York Health Act and establish a single-payer healthcare system in New York State before the close of the legislative session on June 10th. She lives in Brooklyn and has been a member of New York City DSA since 2018. Thank you for joining us. Please go ahead, Emma. If you have anything else to say, please feel free if I missed.
Hi, can you hear me now?
Yes,
Awesome.
we can.
Okay, give me just a sec. Great. And I can get my video working and get started. I'm sorry about this.
Take your time. Take your time. I have to say, Sivan, you've been pretty quick with getting out our Zoom bombers. It's been pretty quick. Good job. So, Stefan, everybody needs to be on the lookout for those Zoom bombers to kick them out very quickly. I'm impressed at how quickly we've been getting rid of them. So good job, guys. Emma, are you all set now?
Yeah, I'm all ready to go. Thank you.
No, thank you. We're glad you're here.
Yeah, well, so am I. I'm really happy to hear about what you have all been working on with this. I think I mentioned to Sivan in my email that I'm the chair of the New York City Healthcare Working Group right now. I'm also the regional organizer for the national campaign for most of New England. So for both these reasons, I'm really excited to hear what you're working on, and I really want to figure out how we can work together to make both of our campaigns more effective. So I don't have any slides, unfortunately. I'm sorry about that, but I'm happy to share notes after I finish talking, and then we move into Q&A, right? So it looks like there's about 20 minutes on the agenda, right? Yeah, okay. So I'll see how long it takes to say the things I have to say, and then we can see if there are any questions. So basically, yeah, I mean, I'm planning to talk about a little bit about how we might take, these state-based bills because New York City and New York State in general, DSA groups and our coalition partners are working on a state-based single payer bill, the New York Health Act, that has a long history going back a couple decades. But we're at a point right now where, the prospects for passing this bill have never been better. We came into this session with majority co-sponsorship in the Senate and the Assembly, both houses, and since then we've been able to get more legislators on board with the bill. So at this point, we're looking to a June 10th end for our session. And the bill is making progress through committees. We're trying to ramp up the pressure from the outside while also working with legislators. And at the same time, within our group, and especially within sort of the research side of the New York City DSA Healthcare Working Group, thinking about what could amount to a much, well, not longer, but a complicated fight for implementation that we don't necessarily understand all the elements of right now. And that would be kind of our next big challenge, were we to successfully pass the New York Health Act. So I thought this was a great opportunity to think through a little bit of that. It's something I've been thinking about even as we're running a lot of, just the basics of the campaign to actually get the bill passed. And thinking about especially, the Canada model, because when we talk about state-based single payer as a strategy in the United States, what often gets brought up is the fact that Canada is sort of this big example of a country that enacted a universal healthcare program with in this sort of province by province way. They started in around 1947, I believe, in Saskatchewan, moving through the next few decades to expand, what was required to be provided, how many costs were covered by the federal government, the provincial government versus patients, to 1984, where this sort of system of, universal healthcare provided by provinces in accordance with requirements of the federal government, with requirements for funding those provincial healthcare systems, determined by you can get this money if you provide a certain kind of universal care at the provincial level. So that's kind of that's what we're always talking about when we're talking about how does state-based single payer work as a path to national Medicare for all. And when you're really thinking about kind of the nuts and bolts of it, I mean, I think there's also floating around like a more general argument that enacting a successful, proven sort of single payer system in the United States would allow for people to understand that it can work, and perhaps like lead to a more traditional path of like passing the federal level Medicare for all bill. But these are just kind of different ways that it's talked about. So another question I'm thinking about here is, what does it look like to start with one state and move to a national system, in terms of how can like other states and how can people working for a national Medicare for all program learn from the experience of a state that enacts single payer first for itself. And this is something we've been thinking about because we're not the first state to try to pass single payer. We won't be the first state if we do pass the New York Health Act to approve a single payer program. And what we're looking at is the things that are the reasons that Vermont or California hasn't been able to successfully implement these programs. And so a couple of the big things that come up are resistance from the health insurance industry, and resistance from legislators themselves, and then other things as well, which is that as you're looking at what it would take to implement a successful single payer program that doesn't doesn't sort of, I don't know how to phrase this. So it's like, there are all these different ways that people who oppose single payer healthcare talk about why it's bad, right? Wait times, inefficiency, you can't choose your doctor, all this stuff. So, all of this is just kind of scaremongering. We have all the information that shows that, this would lead to better outcomes for, the majority of patients, and be cheaper. And I don't have to sell single payer to you, but one thing we're thinking about in New York is that there have to be enough health places where people can access healthcare at the time that we pass the single payer program, so that we're not in a situation where existing inequalities and issues with our healthcare system sort of make it seem as if we've created a worse system by switching to a single payer program. So one way we're addressing this in New York is we're very involved in the fight against public hospital closures in New York City, which has affected, I think, about 20 public hospitals in recent decades, which take on patients who don't have insurance, who are on Medicare, Medicaid, who aren't profitable for the private hospitals in the city, and most of these are in neighborhoods that were disproportionately affected by COVID. So this is just kind of one way we're thinking about, how sort of this central task we have of passing single payer, leads to all these other questions of how can we make sure that in the event of like a rollout, we have kind of a system that can work and can in sort of the foreseeable future provide demonstrably better outcomes. So all this is to say that like the ways that like New York passing single payer can make it easier for other places to pass single payer are also the challenges to New York successfully implementing single payer. The other thing I would say, which I mentioned a little bit, is that if New York passes a single payer bill, it's going to become the focus of resistance from the health insurance industry and other key points of resistance like the American Medical Association. And so on the one hand, it's like, if even so we're able to implement this a system, that means that there's precedent, there's kind of like a developed network of activists, there's proof that this can work for patients. But at the same time, it's like thinking about how a hugely powerful national industry will respond to like an existential threat to its profits is as a single payer activist in New York, something I lose a lot of sleep over. So yeah, I mean, those are kind of my thoughts there. I know there was also a question about how we collaborate with the Campaign for New York Health, which is one of our main coalition partners as DSA for Medicare for All in New York State. So I mean, this has been a long time collaboration over the New York Health Act. The basic division has tended to be that they are working more with legislators while we're doing more of the sort of external organizing. Although I would say that, and I maybe should have mentioned this earlier, that now that New York City DSA has a slate of state level legislators, we've become more involved in sort of the conversations in Albany that are happening around this bill and around other bills. And in general, sort of stepped up our involvement in, directly working with legislators as well as organizing public pressure for our various campaigns. So yeah, I mean, that's the general distinction, but in the day-to-day, we work very closely together on things like social media for our various events. We're co-sponsoring regular bi-weekly phone banks to target legislators for the New York Health Act. We collaborate on strategy, thinking about who to target when, and we, and yeah, okay, I think that was my last point. So this is just, that's just kind of an overview of how we work with them. They're not, our only coalition partner. We have many others, both, other DSA chapters across the state, and then other groups such as Physicians for a National Health Program and New York Progressive Action Network. So we have kind of, we have our sort of New York City-based campaign, and then also a more robust, like statewide campaign that we're working to get off the ground as we move toward June 10th and hopefully getting a vote on this bill. So I'm going to stop there for now. I'm not sure how long that was, but I would love to hear any of your questions, comments, how any of this might be useful to you in Connecticut. And actually, I'm sorry, one more thing I will say is that one thing I think is really important about with this is like, if you're working on federal level Medicare for all, if you're working on state level Medicare for all, one thing we can do right now is figure out ways that activists in states where there are not necessarily, robust state level single payer campaigns, but who want to work on that, or even if there are, but you want to work on sort of these later questions of implementation and how it all works. I think there are a lot of opportunities for that, and that's one thing that we've been doing that I'm really excited about. There are efforts, for example, to develop messaging around why, ERISA, this law about companies being able to provide insurance for their employees, why that's not sort of a fatal flaw in single payer in the United States. There are efforts to streamline, federal funding for state-based single payer. So I think, this is a really important moment for us to be thinking about, thinking creatively and thinking expansively about how to move forward on this issue, even if we're not necessarily pushing for, a state-based single payer program. So any thoughts about that, I'd love to hear as well. Thank you all.
Thank you so much, Emma. If anyone wants to ask a question, please feel free, raise your hand and go right ahead. Go right ahead, Bill. You're on mute, Bill.
Can you hear me now?
Now we can hear you, yes.
Okay. I'd be interested in how the New York Health Act is dealing with ERISA on a state level. I mean, if there's a national program, that's not an issue. A state level program would seem to me a real issue, real problem. But I don't know enough about the New York Health Act to see how they're dealing with that.
Yeah, that's an ongoing question that we're working on with legislators. I mean, I think we're reasonably confident that the bill as it exists can work, and that this isn't, something that makes it impossible. But currently, our research team is working on sort of a way to sort of counter message the idea from insurance companies that this would be a substantial stumbling block. So I don't have a great answer for you right now, but I can definitely take your email and send you one when I do have one.
Unfortunately, I can't hear a thing.
Great work, Emma. Could I ask, have you found it useful to do have you had any city resolutions? And a second question, have you had any, supporting Medicare for all or single payer at the state level? Or have you been doing education sessions for the general public or for DTCs or things like that? Or any kind of, public advocacy groups or community organizations?
Yeah, we in New York City run political education about this stuff pretty regularly. And one thing that's been kind of like a hidden blessing of the pandemic is that it's so much easier to get that out to other people in other parts of the state and all over the country. So it's been like a real opportunity to kind of work on that. Right now we're running like a 12-week reading group session, which you're actually all welcome to come to. I can give you the information for that, on sort of the history of single payer efforts, how it works, kind of the policy side, a little bit more of sort of the political logic of it, how we win, strategy, and this, sort of the deeper stuff of as well of, why healthcare is a human right, how to think and talk about that. And it's really a great opportunity for canvassers, for people working on all sides of the campaign to like start developing an understanding of what it is they're actually working on. So that is like one big way where we are kind of doing, this additional work to strengthen the campaign. I know that other other chapters in New York State have done the sort of local resolution route. And we are also hosting pretty regular public-facing education events about things like, a clear, simple set of answers to questions about how we pay for the New York Health Act, why it's cheaper than the status quo, things like that, really basic objections that come up all the time. So yeah, I mean, there's a ton of stuff going on with that, and it's definitely like a huge part of our work.
Do you know of any polling about support for the New York Health Act there in the state?
I don't have any state-based polling, although that's a great question, and I will ask the people who would know, but we generally rely on federal level polling of, strong majorities for Medicare for all.
Yep.
And just sort of like, the fact that this remains like the easiest canvassing or phone banking that we do, because we get very little objections to it. But one problem we do run into is just a relative lack of awareness that the New York Health Act is a thing that exists, and that not only does it exist, it's like at this kind of key moment right now. So there's a lot of awareness, obviously, of Medicare for all, but less so of the state-based option. So that's kind of a big hurdle we're always trying to overcome.
How do you organize your lists when you do phone banks? You're doing a general phone bank canvas of voters in the city?
We have several different methods, and this is one thing we do collaborate on the Campaign for New York Health with. But we've gotten into a really good place where we have a pretty well-developed lists for people in different districts. So if, for example, in 1 week, we know that a legislator we're working with is trying to bring another legislator on board for the bill, we're doing targeted phone banks for that legislator. And we've seen really good results with that. So we have like a 1 to 2 person data team within the working group that deals with that manages our database and sort of helps us cut lists and stuff. And then New York City DSA does some of that as well. We can message a general membership when we want to bring people out to more DSA internal events. And then, in the event when we are lending a hand to groups outside of the city, we'll work with the Campaign for New York Health or another DSA branch.
Is there anyone else that has any more questions for Emma?
I have one. As a neighboring state, of course, we're watching what's going on in New York very closely. What's the prognosis for passage sometime in the not too distant future?
That's a great question that I wish I knew the answer to. It definitely seems, it's more likely than it's ever been. And it's really heartening to see that, every week we're getting more, another announcement of like a new co-sponsor. It's moving through another committee, so this bill is moving. I would say that there's a substantial chance of passing it in this term, and then in this session rather, and then in the next year, I think partially because of the priorities of New York City DSA, partially because of I think if we don't win it this year, we're going to have to reassess our strategy for the next year. I think that answer, should we not pass it, would be very different. But I think that this longer term work we're doing about how state-based single payer would work, as long as we are substantially invested in a potential state-based campaign, that's going to remain a big part of our work.
Yes, I also do have a question. Yeah, thank you so much for speaking to us tonight. I was going to ask about Governor Cuomo. It was said that he probably would not sign like a state-based single-payer bill like the New York Health Act. At the same time, now recently he has been facing a lot of criticism, and of course, there's like rumblings about others running against him in the next election for governor. So it's kind of like, for example, New York DSA involved in trying to steer things the right way, so that hopefully like a progressive would come into office who actually would like sign the New York Health Act in case the legislature passes it?
Yeah, so I think you have a pretty good handle on the situation as far as what we know. That we're not optimistic that in a normal time Cuomo would be interested in signing the New York Health Act, but the fact that he's in a very vulnerable position, and the sort of way we understand how various actors in the legislature bring bills to his desk makes it seem that there is this distinct possibility that he might be able to be pressured into signing it should it pass. And that's also kind of what we see as one of our main responsibilities, is putting that pressure on him at the very end if we get to that moment. I don't believe we are running a governor candidate in any simple way, but we definitely have our eyes on it, and we're looking at more state level legislators for the next session or next election. So, I mean, one thing we found is that even though we only have about 6 people up there, their ability to work in coordination and sort of present like a substantial, not threat, but like, to really go there and like vote with their priorities and have a voice for democratic socialism at the state legislative level has really kind of like shaken, people in power in New York State. And I think that could substantially shift the conversation about what's possible with this, if we keep moving in that direction.
I'm sorry, Emma, did you mention if I missed this, but did you mention, was there a study bill already passed in New York?
Was there a what?
A study bill, here in Connecticut, we're trying to get, a bill to form a commission to study the issue and come back with a report
I see what you mean.
to the legislature.
Yeah, so so the bill's currently in conference in the Assembly, which is going to do some of that work that has not been done. And then the other big thing we have, which I think is probably the reason that this is not as much of a concern for us, is the RAND Corporation study of the New York Health Act, which is kind of the like marquee study of what specifically our bill would look like in terms of financing and outcomes, with some like, imperfect, but like pretty detailed and thought out models. And, it's something that works really well for us because we're like, the RAND Corporation is not our natural ally, but it's like they have found that like there's substantial savings and like improvements in outcomes with the New York Health Act. So it's something that we based this event we had about how do we pay for it, on this, or we're kind of, waving it around and being like, even they think it's better. But yeah, I mean, that's an interesting data point though, that's kind of a next step you're seeing for the state level fight in Connecticut.
Yeah, they did this, RAND did the same thing for the National Medicare Act that they studied and found it would be less expensive. I wonder why that libertarian think tank is doing all these studies on single payer healthcare, but it's nice that someone's doing that because it's useful information. You can use that to argue, look, there's been a study done on this bill. I'd be happy for someone to do the same thing with, for Connecticut.
Yeah, definitely. And we were able to use that as well as some work from the People's Policy Project and some other groups to build something I'm really excited about, which is a little calculator we're about to host on our website for union members and then others who have other types of healthcare provided through their employer to understand how much they personally will save with the New York Health Act. So this is one tool that's been really useful for us in like this sort of like one-by-one canvassing conversations of like, how will this work for me?
Excellent.
Thank you so much, everyone, for the questions. And Emma, thank you so much for the information and the updates. And we appreciate all of the work that you do.
Yeah, thanks for having me. Oh, sorry, I'm going to put my email in the chat really quick, just in case anybody wants to get it.
Yes, please do. Please do.
And
go ahead,
Emma,
Sivan.
There's also another calculator that was shared during the rollout of the Pramila Jayapal bill that anybody, I mean, it's for New Mexico, but really anyone can put in, their annual income and their, estimated, withholdings and things like that. And it would calculate how much federal Medicare for all would cost you as opposed to, like what you're paying now. It's a really great tool. I'll see if I can find that and drop it in the chat and also send it to you.
Okay, so moving right along to our next guest speakers, we have Sasha Rappaport, Cheng-Sim Lim, and Sean Broadbent. Sasha joined the movement for single payer healthcare as a volunteer with National Nurses United in 2019, fighting for health justice by organizing for HR 1384, the Medicare for All Act, and AB 1400, California Guaranteed Health Care for All. He is a community organizer and board member with LA Forward, fighting for policies that will make Los Angeles a fair, flourishing place for everyone. He also chairs the Housing, Renters, and Homeless Committee for his neighborhood council. Cheng-Sim Lim's road to becoming a single-payer activist began when a cancer diagnosis in 2006 opened her eyes to the inequities of the health insurance system. Since then, as a volunteer organizer, with the NNU CNA, she has worked in support of improved Medicare for all nationally and state single payer in California. She is currently also the outreach liaison of Healthcare for All, Los Angeles, and is active with DSA-LA's Healthcare Justice Committee and Progressive Asian Network for Action. Sean Broadbent has been active for single-payer healthcare since becoming a volunteer community organizer with National Nurses United in 2019. He has worked to support HR 1384, the Medicare for All Act, and AB 1400, California Guaranteed Healthcare for All. He is co-chair of the Democratic Socialists of America, Los Angeles Healthcare Justice Committee, and an active member of Healthcare for All Los Angeles. Sean believes that healthcare is a human right and that enacting single payer is the beginning of justice and health. Thank you all so much for being here. We look forward to.
Yeah, thanks so much, Holly. Stefan, thanks so much for the invite. It's really good seeing you on Public Citizens Medicare for All Resolutions call. Really grateful that they're doing that organizing, connecting all of us together so that we can share what's working and learn from one another. So tonight, just here at Cheng-Sim, Sasha, friends from here in LA, where we, over the last 2 years, have organized twice together for a single payer system. The first time on a national bill, HR 1384, and then this time around, AB 1400. And in addition to other strategies that we're using to help move these forward, help advance them, we've worked specifically together on passing resolutions on the municipal level here in Los Angeles. And we came across something that felt like it really worked well for both getting a lot more people involved, getting them connected to it, and also being able to just effectively advocate in a city as large as LA to be able to approach City Hall. So to kind of wind it back, in 2019, at the start of the year, all three of us kind of jumped right into the push for HR 1384, joining National Nurses United by hosting Barnstorms, which is just a really funny name for a local getting together, local meeting. So we all hosted local Barnstorms, myself in Glendale, Cheng-Sim nearby in Los Feliz, and Sasha over in Eagle Rock. And we were so successful with our Barnstorm that our legislator just immediately co-sponsored. So we were kind of found in this situation of like, wow, we did such a good job rallying for the cause that where do we go now? Well, turns out there are a lot more legislators in Los Angeles City and County. So initially we kind of went out to different parts of the county and continued door knocking with some of the same people and meeting together and organizing in that way. But Cheng-Sim was good enough to host teach-ins at her house. And it was during these teach-ins where we were discussing what was working and also going over the specifics of the bill that we came across a really important idea about how to pass a resolution. So before I get too much into that, maybe Sasha or Cheng-Sim, would you guys kind of like to talk about just that initial effort there with HR 1384 or the teach-ins?
Sure. I think I can hand off, take the handoff from here, John. Yeah. So we started as kind of a small group, kind of that disparately came together through a larger organizing body, which was National Nurses. And from there, we were able to connect with other groups that have been fighting for single payer as well. One of the challenges around any organizing efforts are needing to collect the different groups and build coalition. And I think we were able to just effectively do that in Los Angeles, to the point where we were able to then kind of focus on the different kind of levers of power: county, city, and then lucky for us in Los Angeles, there are bodies called neighborhood councils. And so neighborhood councils, there's actually 99 of them across the city. That doesn't include incorporated areas. Los Angeles is a giant mess of a metropolitan area, but what that really means is there is a form of representation at different neighborhoods, roughly between like 40 and 60,000 people. And so we looked to connect in with both city council members, county board of supervisors, but then the real grassroots efforts were at these neighborhood councils. And so we the first steps are learning about how different bodies derive their power, and how they can kind of flex their muscles in the larger kind of infrastructure of government. Neighborhood councils in Los Angeles are able to write what's called community impact statements, which are letters that essentially are attached to city council motions. Long story short, before there was a motion, we had to go to these neighborhood councils to ask for them to create resolutions before the city did. And so that's what we started doing. And honestly, all I've said to this point is kind of immaterial. What we really did as an organizing group was go to the communities and talk about single payer and form relationships with the communities in order to find the stories that really resonated to everyone. So talking to people that are coming from, that are first generation immigrants, families that were undocumented that had no health insurance, people that went through similar stories like Cheng-Sim, who firsthand felt and were met with the obtuse, horrific systems that we currently have in place. So going through that and talking to the communities and amplifying their stories and sharing them led to us being able to start gathering that support and passing resolutions that then were connected to the city government. Then at one point, the city government, through pressures from a number of different kind of bodies around that were organizing, were able to actually get a motion passed. Language that came directly from what we had created at the neighborhood level, along with Citizens United, Public Citizen, that they created for kind of the larger organizing effort for creating resolutions. So literally that language was then, just slightly adapted for the city of Los Angeles. At that point, we were then able to go back to these groups that we had relationships with. The most important, piece of this is continue to build those relationships with these different community organizations, in this case, our neighborhood councils, to then go back and say, hey, we need your support because now we have a way to show the actual impact. So then we got community impact statements. And so over a course of a few weeks to I think it was like 2 months of direct, active organizing, we were able to get enough community impact statements. Sean, correct me, I think we had like 15 community impact statements, 14, 15 out of like 19 resolutions. So we, 19 different neighborhood councils basically sent in multiple letters to their representatives, to the point where we were able to actually have a little bit of leverage, and then they brought that motion to city council, and then from there, maybe I'll pass it back to either Cheng-Sim or Sean to talk about the day of and what we did to actually organize people to show up to make public comment and to advocate the day that it came to LA City Hall.
Sean, why don't you take that, and I'll follow on the state level efforts that we're making now.
Sure. Yeah, that sounds good. So on the day of, we definitely wanted to we didn't know when it was going to come before City Council, but we definitely had subscribed to be receiving the agendas. None of us were inside of City Hall being fed that information, but we did get the email alert just like everybody else did. And we immediately worked the phones for all the activists that we had been knocking doors with or been making presentations with. And we especially invited our neighborhood council members who had submitted a community impact statement, because they actually got an additional amount of time to speak at City Hall. So then we were able to kind of go through with them, what talking points might be that they might consider. If we had talked to them about their personal story, really encouraged them to tell the personal story, because we find that's what's most powerful. And here in Los Angeles, this gets kind of broadcast out on like a public access channel, as well as being available online, so that there are multiple ways that we can kind of signal boost this and make this like a day of advocacy for single payer. So we got the folks together, kind of confirmed who was going to be present, and then we had a very simple rally out front of City Hall, just not with a sound truck or anything fancy, but with a megaphone. And then we had from the local Nurses United rep some signage for Medicare for All for HR 1384. We were able to space out really nice on the City Hall steps with those, give our testimonies, and then having heightened the energy of the group, kind of marched into City Hall together and signed everybody up for public comment. That was really important. A lot of people needed to be walked through exactly how to sign up for public comment as they're going in the door. So just making sure that you've got people who can help handhold through events like that, really important. And then, I don't know, what did we have? We had like, I want to say an hour or two of testimony. It was really, really powerful there in the city chambers. And then a really good passage of the resolution with support from the majority of the council members. And then I'd say the biggest effect from that we were able to go then and use is we focused on a certain part of the city where there was a holdout member of Congress. And that member of Congress, when the new Medicare for All bill was introduced, was an original co-sponsor this time. So we took the resolution, we focused in on that person specifically, made sure to stay present in his district, and continued to organize. And that's the most important thing. Like, a resolution doesn't do anything more than the activists who are going to then go make use of it. That's what I would say is the biggest takeaway. And then Cheng-Sim, we have this wonderful opportunity this year, thanks to the nurses and also Ash Kalra.
Yeah, so we there have been several attempts over the years with California to for a state single payer bill, and it's been difficult. There were times when the legislature passed it, but then we had Arnold Schwarzenegger as the governor, and he vetoed it twice. But then, the thing that we've learned with California is nationally, they can point to the, Democrats can point to the Republicans and say they're the ones blocking anything, right? In California, they can't do that because it's a supermajority Democratic state. The governor is Democratic. He ran as a supporter of single payer, but then when he got into office, he's been walking back that support. So there is, so I guess for us in California, it's not a question of what party they are. It's a question of, whether they're bought by the medical industrial insurance complex, or they're not. And it's a Republicans are actually immaterial to our fight for single payer in California. It's all about the corporate Dems and the ones that are are not corporate Dems. So, but it's a tough fight. You know, it's very, very clear in a state like ours that the insurance pharmaceutical industry, they have a lot of money and they have a strong grip on power. It's a very, very tough fight. And, you know, you would think with the supermajority that we have, we should have gotten single payer years ago. There have been financial studies made, for the viability of state level single payer in California. And, you know, they all show that the state's gonna save money. Even the first year of implementation, the most recent sort of survey of state single payer systems, the financing of state single payer systems, UC San Francisco released this survey of a whole bunch of financial studies. And it came out just last year, 2020. And they found that in 19 of the 22 models, not some of these studies were undertaken by, you know, conservative think tanks and whatnot. But anyway, 19 of the 22 models predicted net savings in the first year after implementation, averaging 3.5% of total healthcare spending. So what I'm trying to say is, what we have found in California is that it's not financing that's the problem. It's not support. The recent poll in California just came out a few days ago, and it said that, you know, 80-something% of Democrats. This is a poll actually taken about the recall, recall for the governor. But they said 80-something% of Democrats in California actually support state level Medicare for all. So it's not a question of like support, you know, in terms of the population. It's not financial viability. The problem we have in California is very clearly a problem of political will. We have politicians that just are blocking blocking state single payer, you know. So that's our fight. And what we're doing, you know, I mean, there are people who are, you know, doing the legislative track, right? But Sean, Sasha, and I, we are grassroots organizers. So we've been, you know, more focused on that. And the latest bill for state single payer, it's called CalCare, AB 1400, and it is sponsored by the California Nurses Association, introduced by Assembly Member Ash Kalra. And so it was introduced in February, and then it's been tabled so that, you know, it'll come back next January, basically. So we have 68 months of organizing statewide to get it to the point where our state, you know, our elected officials, you know, feel that they must vote for it. And that can only come with pressure from their constituents. And that's what we're focused on now. And using the lessons that we learned from the resolutions effort for the Medicare for All bill nationally. One of the things that was very interesting that we didn't anticipate when we started that effort in 2019 was that, you know, we thought, okay, well, you know, a resolution is a resolution. And like Sean said, you know, you use the resolution afterwards, right? But one thing we hadn't anticipated was a really good lesson that we learned was that the process of actually organizing for the resolution is actually a process of base building. Especially for us in Los Angeles because of this neighborhood council infrastructure, that this was, you know, that reaching out to the neighborhood councils and educating ourselves. Like we had to educate ourselves in order to go speak with each neighborhood council. And the process of educating ourselves was essential to, essentially equipping ourselves to talk effectively to make the case for Medicare for all. So, so organizing at the grassroots level with, all of us having to go speak, like each one of us has to go speak to our neighborhood councils and make the case and present the case. And so we took the opportunity, to educate ourselves and made us, essentially, stronger advocates for single payer. And then talking to the neighborhood councils, that's educating them on single payer, because a lot of them didn't know what Medicare for all was, and that was a way for us to address some of their worries and the concerns and the propaganda that comes from the insurance industry. In 2019, we found a lot of it was, how do we pay for it? How do you pay for it? And something interesting now is that we're not finding that question much anymore. We've started reaching out, and already we've had, I think, 7 or so neighborhood councils that have already passed community impact statements in support of the motion that has already been introduced in the Los Angeles City Council by a council member, Mike Bonin, who some of you who attended the public citizen event a couple of, maybe last month, might have seen that. So anyway, we kind of, were able to skip over some of the steps we had to take in 2019 because we had a supportive city council member this time who could, jump in and just introduce the motion. So that saved us a lot of work in the beginning. But so we are now speaking individually, to the neighborhood councils to pass community impact statements in order to try to move the motion out of the committee in the city council. So educating the neighborhood councils now, it's really interesting because we're not needing to, to make the argument about why we need single payer anymore. People, we needed to make that argument we found in 2019, but now I put it down to COVID, the COVID experience. People see it very clearly that we need single payer. So, but what we are doing is that we're educating people about this new single payer.
The grass is greener.
A lot of people, know about Medicare for all nationally, but they don't really know what's going on at the state level. But there's this new bill, and it's called CalCare AB 1400, and what does it do? So this time we are educating people about the state bill, letting them know what it is about. And the third part, which has been really good about this grassroots organizing, is that, as we educate people, we end up being able to activate new people, bring in new people to the movement. So that is the sort of, base building benefits out of this resolution process that we didn't know about when we started doing it, through Public Citizen and the Nurses Union in 2019. And then this time we're thinking, that each stage of our resolution effort needs to be a way to, we need to build on it stage by stage. So if we can pass the resolution in the LA City Council, that's very important because Los Angeles is the largest city in California. Then we want to also get other cities in the LA County to also pass similar resolutions. and if we are successful in getting, you know, enough of shall we say, you know, momentum, we want to, you know, go to the LA County Board of Supervisors, and LA County is the largest county in the country, not just in the state of California. It's huge.
And it gets at a dynamic that, like, the Bay Area was very quick to pass these municipal resolutions, and also at the county level. LA as an area, much slower. So far, you know, it's actually outside of LA that we've seen some resolutions passed in Southern California. So we have this kind of, like Cheng-Sim was saying, a corporate democratic governance that we're kind of needing to really push them to act on the support that exists. The 84% of Democrats, who are the majority in Los Angeles, want them to take action on single payer, on this bill that exists, that's here, that's right in front of them, and can take action on it. Before we get to Q&A, some folks probably have heard that the bill was tabled. And so just a quick little thing on what that means. We've spoken with the author. He is going to be continuing to meet with legislators to get their support for co-authoring. And he specifically asked for us to continue passing municipal resolutions so he can point at those and say, here's what your constituents passed in your area and what they want. And California operates on a 2-year legislator. So in Texas, it'd be game over because this is their last month to meet for 2 years. See you in 2023. In California, we'll be back in January. So we have a actual short amount of time to build the groundswell of support that we're going to need to take on the corporate intransigence. So wish us luck, okay?
And yeah, and then the other part of it, you know, in terms of using this resolutions effort is, you know, this continuing upwards pressure, right? So if we're able to get these resolutions passed at the municipal level, then, you know, when constituents, you know, organize legislative visits, right? So they can come into those meetings saying, you know, your city passed this resolution. Why aren't you supporting it? If the state legislator isn't supporting it, or if they're supporting it but are kind of, you know, not doing much to champion it, then, you know, they can use this as, you know, ammunition, resolution as ammunition to sort of stiffen the spine of their elected representatives. So it's thinking, you know, we're thinking more clearly this time in terms of like building at each stage, like, you know, we're going to use so the, as Sean was saying, the author of the bill, you know, is saying that the resolutions will work for him and his fellow co-authors and co-sponsors of the bill in the state legislature to use as a persuasion or stick, you know, to get their fellow legislators on board, right? So they can use this municipal resolutions tool in, you know, in their corner, and then we on the outside can use the resolutions tool in putting upwards pressure on our own, you know, state representatives. So it's something that is a tool that we can then use besides just thinking about it as a resolution. And for us, you know, because LA County is huge, LA City and LA County is huge, even if it's slower, it'll have a big impact in terms of, you know, the state. So the other thing I wanted to mention about our state single payer bill, which I'm very, very pleased about, is that it's the first bill. Now, I don't know about the other state bills. So, you know, but in terms of the California state single payer bills, it's the first California state single payer bill I've read that clearly integrates multilingual, culturally sensitive care, that it really integrates equity as a key part of the bill, that it's not something that you set aside that in order for there to be true healthcare for all, right, healthcare justice for all, that in a state like California, which is majority minority, having multilingual, culturally sensitive care is key to having equity in healthcare delivery in the state. So that, for me, I mean, language is very dry and legalistic in the bill, but to me, it's very beautiful because it's the first time I've seen that in any state single payer bill in California. And then the other part of the bill that I like and is, and I saw that, in your summary, Stefan, in your slideshow, that I saw that you have that also in your Connecticut. So that's very exciting. And that is for the first time in a long, long time for California anyway, we have a single payer bill that is a true single payer bill, meaning it removes the HMO loophole, the Kaiser loophole, we call it, because the last state single payer bill that was actually blocked, it passed the state Senate, but it was blocked from even getting any consideration in the state assembly by the assembly speaker. That was in 2017. That bill actually was supposed to be a single payer bill, but it had the Kaiser loophole. And Kaiser is a big, important healthcare, medical industrial complex player in California. They constitute 1/3 of the medical delivery infrastructure in California. So this bill removes that loophole. It takes away the ability of Kaiser to operate as an insurance entity. They would still be able to function in terms of their hospital and healthcare functions, but the insurance business that they run would not be able to go forward. So this bill is a true single payer bill, and that's lovely. It's not a multi-payer bill masquerading as a single payer bill, as previous single payer bills in California have been. So yeah, we'd be happy to sort of learn from, what you're doing in Connecticut as well. Or if you have any questions or comments for us.
So I have a question. So if your employer, or you have insurance through your employer, how does that work then? How would that work in California? Would you lose that? Because that's always a concern with people. They like what they have.
Well, the thing is this, with a COVID experience, right? A lot of people who used to get, there's a lot of people who are unemployed, lost their jobs. And if their jobs, was tied to employment, they lost their health insurance too.
Right.
And then I have personal experience, and I actually work freelance. So I use, I'm covered by my husband's insurance coverage. And he didn't get enough hours during this last COVID year. And he worked in the film industry, and it's a kind of a complicated system, but you have to, they work a certain number of hours before you get your health insurance. And it's a really, really good health insurance if you can get it. But because he didn't make enough hours during the COVID year, we couldn't get health insurance, and they had to go on COBRA. I'm kind of not addressing your question full on for now. I'm just sort of laying out the fact that the problem that we have our current system is very unstable, right? Mm-hmm. People understand now that even if you have good employer-tied insurance, you can lose it any minute.
Right.
Right? So it's very unstable. So you don't want to have employer-tied insurance, even if your employer-tied insurance is good, because that shouldn't be the basis by which you get healthcare. It's not through whether you have a job or not. You should have healthcare, period. Right? So then the second part is, you know, if you have healthcare through your employer, do you lose it? You don't lose it, right? You probably, you know, the financial studies that have been done, right? It shows that in California, at least, for the average family, they are, you know, a lot of people who get, you know, employer-tied insurance, right? There's actually a range, you know. There are some people who get really good coverage, you know, and then there's some people who get really bad employer-tied coverage, because, you know, a lot of like small businesses, especially because they can't really afford to do the whole package. So you could have employer coverage with, you know, high deductibles. So what the single payer and Medicare for all will do for you at the state level is that, you know, you no longer have to worry about, you know, so let's just say you have health insurance, like the best, right? It covers you get eye care, vision care, hearing, dental care, you know, you know, you will still get that, right? You will still get like high quality care. And for the average, the estimates in some of these financial studies for California are like, if you have annual income of $100,000, like this is a 2017 study, $100,000 or less, you are going to save, you're actually going to pay less in premiums, co-pays. I mean, if you factor in like you're gonna get more coverage, right? In, you know, with you in addition to say vision, hearing, and dental coverage and all that, you're gonna get mental health, like, you know, coverage, like therapy, which is usually not covered, like in most people's like yeah, even really, really good healthcare package. You're not going to get long-term care covered. So all those things that are not covered, even in the usually like the best, like employer-tied insurance package, will be covered, right, with single payer. So you're actually not losing anything, you're getting more, right? You're getting more. And then what you pay out is, if you're earning $100,000 and less, is going to be less than what you would be paying for a more meager employer-tied package, because, you know, the you know, like it'll be a big fat zero as far as premiums, deductibles, and copays are concerned. Big fat zero. So for people who are earning $100,000 or more, you know, there's like gradations, right? You know, some people will be paying the same amount that they've been paying out in premiums, deductibles, and copays for this new single payer system. But again, they'll be getting more. They'll be getting long-term like care and other coverage that's usually not covered in your standard medical insurance, like insurance package. And then, you know, if you're really, really rich, you're not earning a lot of money, then it's a different ballgame. You'd be probably paying more. But it's a, you know, progressive, you know, it really depends on like how they design, you know, the how people are paying out, and it depends on the kind of progressive taxation structure that is adopted by the state, and so we can't really be absolutely certain exactly how it's going to work, and down to the dollar and cent. But in the general sense, you're going to get more by paying less. So you don't lose anything; you actually gain.
Mm-hmm. Thank you. Because I think that's the people that I've talked to, that's the thing that they struggle with, because they say, I'm happy, I have a good plan.
Well,
So.
people are happy with their coverage because they are able to see the doctors or the providers that they like, as opposed to saying, I love my health insurance company. I love having, EOB sent to my house, or I love, being sent to the wrong billing thing. And I think what Cheng-Sim has said so eloquently is that Medicare for all or single payer, what it does is similar to other government programs like public education, like roads, like postal service. You would just get it. It would not be tied to anything that would be any different than that.
Gotcha.
I think Sasha had something quick to say. Sorry, I might have cut you off, or Sean. I'm so sorry.
No, I mean, I was just going to say, what ends up happening in a single payer system is that your insurance just changes. You end up taking on a different provider that gives you expanded coverage. That provider just happens to be the state. But you don't lose, like has been repeated, you have a change of provider that gives you expanded coverage. You get a better deal, and often you pay less.
And not only that, there are no more in-network, out-network. Out network. You can go to, if you love your doctor, you stay with your doctor, but if you don't love your doctor, you can go to, any other doctor. You're not restricted anymore. And you don't have to I have a friend right now who's undergoing, cancer treatment. And, she is having to spend time, like yesterday, I spoke with her. She's having to spend time getting on the phone with the insurance company, because the insurance company is, saying that she can't have life-saving. This is like life-saving. She cannot not have this medication for her cancer treatment. And the insurance company is saying she can't. Who are they to tell her, when her doctor is prescribed, that she needs this medication in order to stay alive. So all that will be gone. And this is more than even just like monetary issues. This is stress, which is stress on people's lives, which is ridiculous. Like, why should a health insurance company have to tell us? It's the doctor that should have any say in the kind of treatment we get or don't get.
Okay, thank you guys so much. We agree with you 125%. We are with you. Please let us know if there's anything we can do to help you move forward. And if we can, give our support to you, help with letter writing campaigns, or please let us know. We are here to help you and support you 100%. And now, Stefan, a quick update on legislation here, please.
Actually, I was wondering, is Representative Winkler still with us? Representative Winkler, are you available to give an update?
Yes. Can you hear me?
Yes, we can. Can you fill us in about what happened with SB 1090? Do you know anything about the Connecticut single payer study bill?
Well, it's alive, but it is an odd bill in that the only people supporting it right now seem to be the left fringe, such as myself, and it only has House co-sponsors, no Senate co-sponsors, which is strange in a Senate bill. So obviously more work has to be done to get moderate support. As long as I'm here and I'm in the middle of session, so I'll just quickly say Senate Bill 956, the medical assistance regardless of immigration status. The Appropriations Committee did not shy away from that bill, despite a fiscal note of $67 to $116 million in the first year and $200 to $250 million in the second year. But it's still alive. And, watch out, because maybe some federal money will be sent that way, and we'll be fighting another battle in 2 years. House Bill 5430, This was a bill concerning 20-minute visits for immunizations. That bill was incorporated into House Bill 6423. When we eliminated the religious exemption, we also included the 20-minute visits. So you can, in a sense, say that bill has already passed. And that's it from me. I must get back.
Thank you so much.
Thank you so much.
My pleasure.
Sorry, Stefan.
No, Holly, it's all good. Yeah, thank you. That's a great update, Representative Winkler. So yeah, we already touched a little bit on the status of the bills earlier. So yeah, for the first year of Medicare for All Connecticut, doing this advocacy like on the state level, I think this is incredible, like more than we could have ever imagined, like we would achieve with HB 5430 or the SB 1090. So and then of course there's also other legislation. So for example, the public option bill, which is SB 842. So there's a lot of pressure against it, like a lot of, for example, the Connecticut Partnership for Healthcare Future or insurers like United Health have been sending out also kind of like misleading information or like been running ads against it on Facebook. So yeah, I think there was also the expansion of Husky A, like might only be in the budget now up to 170 or 175%. So it's not kind of like the full restoration that the SB 842 was originally envisioning. And yeah, besides that, of course, as Representative Winkler just mentioned, there's a campaign for Husky health coverage for all immigrants regardless of immigration status, the SB 956. And then finally, there's a bill on the federal level, which is the State-Based Universal Healthcare Act, with the lead sponsor being Representative Ro Khanna from California. And that would make it easier for states to implement single-payer programs. So that was in the last Congress, HR 5010, and it's about to be reintroduced for this Congress in June. So I think that was kind of in a nutshell the updates regarding the healthcare bills.
Over to you, Sivan. Thank you, Stefan.
Yes, thank you, Stefan. So that is to say that, yeah, our bills that we as a team worked on, you know, have not passed, but there's still so much work left to be done throughout the country and here in Connecticut. So we were first hoping to ask everyone here to hop over to our Action Network. I'm going to drop this in the chat put this in the chat to thank all of our state legislators who supported our both HB 5430, which was our bill to actually enact Medicare for All in Connecticut, and also SB 1090, which was the study bill to enact a commission to study the economic impacts of Medicare for All, a single payer system. So if everyone looks at the chat now and clicks on this link here, you will be taken directly to a letter writing campaign where you can simply and easily put in your name, the information that it asks of you, and it will send a template thank you letter to the 23 legislators, state legislators who supported us throughout this effort. You can also customize that letter however you want. If you want to put in your own personal story and how it would, you know, how Medicare for All would have been helpful to you, or you can just send that as is. And then, as Stefan was just mentioning, there's a one-payer states, which is another group not unlike ours that focuses on passing Medicare for All on state levels. and they're working with this California Rep Ro Kahana. He will be introducing a new state-based Universal Healthcare Act. And so it would be great if we can also, here's another action we can take, is if we can do the same. And this, no matter where you are in the country, will, if you put your information in, it will send a letter to your congressperson. So I just did it before, and it sent a letter, automatically pulled up my state representative, who is Rosa DeLauro, and it sends that letter over to her so that she can know that I, as her constituent, want for her to support this bill, co-sign, co-sponsor, whichever the right word is, and know that this is important to me. And these are really important, quick actions that people can do that's not face-to-face. You can do it from the comfort of your own couch, and has a very large impact. As I believe Stefan said, when we had the SB 1090, the study bill, go to appropriations, we sent, in 24 hours, we sent over 7,500 emails, which is pretty incredible. So if y'all can quickly do those two things, that would be amazing. And if you have any questions, please let us know. We're info@Medicare for the number 4 allct.org. Thank you. Or if you have any questions now.
That would work as well. If you have questions, please put them in the chat, or you can raise your hand. Next, we have Rana for updates on town resolutions. I don't believe that James is here to give an update.
No, he hasn't been able to make it tonight, so he sent an update over to Rana.
Well, I don't really have the
great.
update.
Okay.
I am going to hand it over to Sivan, who I think does have the update and lives in New Haven. But I just wanted to start by noting that there are 2 towns in Connecticut that have already passed resolutions. New London did last year, and Wyndham did, and Donna's on the call. She was instrumental in getting it passed in Wyndham a couple months ago. So, we're big believers in the power of resolutions to let our legislators know what an important constituency is in favor of Medicare for all, not just people, but neighborhoods and towns, municipalities. So with that said, the latest big effort is in New Haven, and I think that Sivan has the report on that.
Yes, thank you, Rana. So we are now calling ourselves the New Haven Coalition for Medicare for All, because we are quite a large group of all different groups such as ourselves. So there's Central Connecticut DSA, us, Medicare for All Connecticut, us being everyone here, Our Revolution Connecticut, the People Center, Bill is here from there, Connecticut Drivers United, which is a union of like taxi drivers, Students for National Health, and a couple others have provided testimony for this. So we had a workshop with the Health and Human Services Committee of the Board of Alders, and that went so well that they've actually asked us to hold a second workshop with them, which we are just waiting for a date. And they received over like 86 pages of positive testimony. nothing in the negative. The alders seemed really interested and wanted to see, more community outreach from us, which is certainly our intention, especially over the summer, to do phone banking, canvassing, tabling events, things like that, to, as has been mentioned at one point, I think Emma Claire had mentioned it, that, people really need to learn more about what Medicare for All actually means, instead of, just sort of hearing about it. Let's see, we were also in the news. We were in the Yale Daily News. I'll have to try to find the link and put that in the chat. But that was really exciting for us. I don't think any of us knew that we were going to be in the news. And as I mentioned, yeah, we have the second public hearing that the date is TBD, but hopefully that'll be by the end of May, early June. And we've also established a small organizing committee to work on the more finer details of things. So it's going really well. And hopefully, this, can go through and really send a huge shockwave. If New Haven passes this, even though it's non-binding, I think the fact that one of the largest cities in Connecticut, and with such a diverse population, and an insurance sort of agency here with the Yale Hospital and Yale here, would just knock things right over, which is our intention. So I'm really excited for it. If you live in Greater New Haven area, or even if you don't, and you just want to get involved in it, just reach out to me, and we'd love to have you all along. So thank you.
We also have several resolution teams working on different levels of resolutions in Hampden, Groton, Middletown. We're just discussing Bridgeport and Hartford. Yes, Hartford. We have been approached by all of these areas and towns and cities to start resolutions. And if anybody would like to join on these groups or anything, please send all of your information to info@medicareforallct.org. I think it's in the chat, but we'll put it in again. Thank you very much, Sivan. And we are really trying hard to get these resolutions going. And we are going to be successful because of all of the support we have from all of you. So thank you for that. So we have a lot of upcoming events and meetings keeping us all very, very busy. So we are trying to be very respectful of everyone's time. So I will again turn it over to Sivan.
Sorry, I didn't know I'd be speaking so much tonight. But yeah, so if Medicare for All is your thing, then May is the month for it. I think it's also, this week is like National Nurses Week. So snaps to all of our nurses and healthcare people like that. You are all amazing. We appreciate your work, especially this year, more than ever. And thank you all for caring for all of us and having more bedside manners. Nurses are great. So in terms of our group, there's going to be the first official board meeting tomorrow night. Yay! And so we also, during that time, we'll be going over like, bylaws and articles of incorporation and things like that. But we also hope to establish some committees that will be open to all members, such as like community outreach committees or research and education committees that anybody here can join and help us in all capacities, like fundraising or events, things like that, because as a movement, we will need, everybody's help on those things. Then on, so National Nurses United, which is the National Nurses Union, they're going to be holding a Zoom webinar on Medicare for All and communities of color. So that will uncover the layers of discrimination in our healthcare system and demonstrate why a single payer system like Medicare for All can transform health outcomes for communities of color. And they have 3 options for attending. I know we're, like myself, Shefan, Holly, and Rana, we're all attending different ones because we're really excited about this webinar. So I will put this in the chat. One of them is tomorrow at 7 p.m. Eastern time. Then one is June 9th at 7 and July 7th. I believe that those are all the same. Like it'll just be sort of a recording, but who knows? And so here are those links. And again, we'll send these out just in case you know, you're not able to see the chat. Then Medicare for All Resolutions National is hosting a webinar on Thursday, this Thursday at 8 p.m. And I will be on the panel. They've invited me to the panel, which is really exciting. And so other panelists who are well more qualified than myself are people from Public Citizen, United We Dream, Congresswoman Sarah Jacobs from California, that's kind of cool, and the president of Amalgamated Transit Union Local. So you can register for that at this link. So if you want to hear me blabbering more, there's that one. But wait, there's more. Then there's Recovery for All Connecticut, which is, I'm assuming they're fairly new. They're this great new organization that is essentially trying to hold our state legislature accountable for a recovery for all Connecticutians. And so they're holding a tax day rally. Tax day is May 17th, which is quickly approaching. I need to do my taxes. In front of the state capitol in Hartford to demand that the governor and legislature pass an equitable state budget that will fund our future by repairing the broken tax structure and making big investments in our struggling communities, which is incredibly important because a lot of what neo-capitalism will do is saying if there's no money coming in, we need austerity. We certainly do not need austerity. We need the exact opposite. We need to be taxing rich people to pay for us. Then on April 18th, oh, so I put the Recovery for All Tax Day Rally information in there. It's a Facebook event. There's a link right there. On May 18th at 6 p.m., oh, sorry, 9 p.m. our time, our friends at Whole Washington, which is another statewide Medicare for All group, is hosting their next book club meeting with very special guest, Dr. Abdul El Sayed, who has one of my favorite podcasts about Medicare for All on. He's a physician, epidemiologist, public health expert, and progressive activist. He rebuilt Detroit's health department after the city's bankruptcy. And he was their health commissioner as well. And so he ran for governor of Michigan in 2018 on a state level single payer platform. And his bid was endorsed by Bernie Sanders and AOC. And so you can register for that. I'm certainly going to be checking that out because he is just awesome and has a really great story. And I haven't read the book, but you know, who reads books anymore? And so really interested in checking out. Last one, I promise. Then Oregon One Payer States members are holding a town hall on May 19th on how to pay for state-based universal health care. Now, I think this is going to be more centered on like Oregon and how they're going to pay for it, but I'm sure there's going to be transferable information within that. And so here's the Zoom registration link, and there's also a flyer for the event. And so, yeah, that's a lot of stuff happening, and that's just what we know of. And you know, our hope is that very soon we'll be hosting more events and activities like these. So you know, but we can, you know, ride coattails until then while we're figuring things out and building our structure, and then you know, having those committees and other activities that we can all be involved in. Okay. Thank you.
So if there are any other questions or comments or anything, please, I don't want anyone to jump out. Go right ahead there. Bill, go right ahead.
Just to add to Siobhan's list. Can you hear me? Add to Siobhan's list. New England Healthcare Employees District 1199 is preparing strike notices at nursing homes and group homes in Connecticut, probably next week. This is presuming that the Recovery for All Coalition is unsuccessful in getting the governor and the legislature to come up with the dollars to actually fund those services that are needed. These are all direct care workers, 4,000 to 6,000, 4,000 nursing home, 2,000 group home workers who may be going on strike. Urge all of you to support them. SEIU, New England Joint Board, has backed the Massachusetts single payer bill, or the National Medicare for All. SEIU has been a fighter for universal health care for many, many years, and as has District 1199. So if there are picket lines there, I urge you to be there and also talk to your legislators about coming up with the bucks. Thank you.
Maybe Bill, we can get all the information for you, and we can include that in our follow-up. Thank you for attending this meeting.
Yeah, there's nothing set yet, but when I have something, I will pass it along.
Thank you so much, Bill. Is there anyone else who has anything that we should be trying to attend in solidarity, or any questions, comments, anything else? We have 5 minutes, guys. Anything?
Thank you, guys. Great meeting.
Thanks, Justin. It was very nice for all of you to stay for the whole time. We appreciate it. Thank you all for being here very much. It can't be done without you guys. So it's greatly appreciated. So I hope you all have a wonderful, wonderful evening, and thank you for your time. We appreciate it very much.
Thank
Good night, everyone.
Good night, everyone.
Good night.
You're on mute, Sivan.
That went so well.
It did. We can stop the recording now, I think.
Yeah.